I would rather die poor and penniless than have this issue, said a very close friend of mine. He went on to add, erection is the number one indicator that your overall health is actually okay and that you are fit to reproduce. I would rather die poor and penniless than have this issue, said a very close friend of mine. He went on to add, Vinod, I can be a billionaire, but if I don't feel like a man, it's of no use. I would rather trade being a poor man with a good erection. Well, that's the topic for today. We're going to speak about erectile dysfunction, which typically affects men right from their late 30s and particularly in their 40s and beyond. Not enough men seek help. They don't share it with anyone. Very few people do. And very few of the men even go to their doctors to get it cured. They just think that it's a function of age and they don't act on it, unfortunately. I also think that it is a very sensitive topic that men don't want to express it. In fact, during one of the events that I attended where it was related to the health, one of the founder of a men's health app, he mentioned that people as early as late 20s are coming to him and typically with erectile dysfunction as the main reason in men's sexual health. So what I'm going to talk about, go through the definition of erectile dysfunction, and I want to describe about the biology of how it happens, what parts of the body are involved. What does the erection actually indicate? What does nature trying to tell you, or what is the body trying to tell you? A little bit about causes. I don't want to go too deep into it because people already have done some damage because that's what erection indicates. But we'll talk more about how to fix it naturally. I'll give you some examples from my life, and then we'll also talk about what the doctors recommend and some natural way to find some remedy. Okay, let's go. Let's start with the definition. I'm going to read it so that I don't make a mistake. Erectile dysfunction is medically defined as the inability to get or keep an erection firm enough for satisfactory sexual activity or intercourse. I'm going to read that again. It's the inability to get or keep an erection firm enough, that's the rigidity, for satisfactory sexual activity or intercourse. It's a condition characterized by a persistent or recurrent inability to achieve and maintain a penile erection of sufficient rigidity and duration for sexual satisfaction. I hope the definition is clear. It is common especially for men in over 40s and can affect emotional well being, self esteem, and intimate relationships. Because ED can be a sign of other medical conditions, and we will talk about it as we go to other sections. I'll give you some statistics so that people know. ED affects about 40% of the men by their 40s, and the risk increases by about 10% per decade thereafter. Physiological decline starts earlier, often in their 30s, indicating aging related changes begin well before the symptoms actually appear. Some men in their 20s and 30s experience ED, often with physiological rather than psychological causes. So, there are physiological damages that can cause ED, and also there are psychogenic causes, but I'll not go too deep into that. We'll stick to the vascular and the physiological changes. So, a lot of questions typically comes around, is it purely men in 40s? Is it is it I can masturbate but I can't have intercourse? What is that characteristic? So I'll read a little bit around that too. They can masturbate but cannot have penetrative sex. You may, right? So men with erectile dysfunction can typically masturbate. In some cases, men with ED can achieve erections sufficient enough for masturbation, even if they have difficulty during partnered sexual activity. Masturbation can sometimes be easier because it involves less psychological pressure, anxiety, or performance worry compared to sex with a partner. That's understandable. All men would agree how we feel before having sex with a partner. However, men with severe ED or certain underlying medical conditions may also find it difficult to achieve an erection even during masturbation. The ability to masturbate varies depending on the cause and the severity of ED. So, I think we have kind of defined erectile dysfunction very clearly, that it's the inability to get or maintain sufficient erection and rigidity to have partnered sexual activity. It also extends to masturbation, but mostly it's centered around sexual activity of the partner because that's what we were intended to have. Anyway, so Now that we've defined what erectile dysfunction is and some statistics around men in 40s, and if you're a man in your early 20s or 30s, it is still important for you because you don't want to be one of the men who has erectile dysfunction. So imagine, right, if you see men above 40, 2 out of 5 or almost 50%, 1 out of 2 men have this issue, which means they can never have sex again or they're struggling to even have an erection. And that's not a great state to be in. But don't worry, we'll fix it. So let me also talk about why erection is important and how the body creates erection. Now, for the body to actually create an erection, your brain has to work fine, and that's the origin from where erection actually starts. Erection requires a complex chain of events in a coordinated manner. Erections are metabolically expensive events. I want you to remember these two things. It's a complex chain of events in a coordinated manner. There is a sequence of things that should happen with well timed manner. And erections are also metabolically very, very expensive. Now, step number 1, the brain. Sensory or mental stimulation triggers chemical signals in the brain. Number 2, the nerves. These signals travel down your spinal cord to your penis. Number 3, the blood vessels. Nerves release chemicals that cause the blood vessels and the spongy muscle tissue, corpora cavernosa, funny names, in the penis to relax and widen. Number 4, the trapping mechanism, the very important one. Blood rushes into the penis at very high pressure. Expanding tissue presses against the veins that normally drain the blood away, trapping it inside to maintain firmness. Now, imagine there is a blood going one way, and then your penis expands, and then the veins that are supposed to drain the blood is actually constricted enough that there is no blood that is going back, which is why you can maintain the erection. So you've understood that different parts of the body are involved. Your cardio system, your vascular system, your nervous system, your hormonal system, and your brain, and actual part, the penis that is involved. Now, what does it actually indicate? Why is it so complicated? There's a very strong connection to overall health. So I'll explain that why. Early indicators that your arteries are possibly constricted. Now, your penis has arteries. That is, arteries are the ones that is carrying blood into the penis. 1 to 2 millimeter is the width that you have. Heart has 3 to 4 millimeter arteries, while your carotid has about 7 to 8 millimeters. Of course, so the blood flow to your penis kind of indicates if the artery is functioning fine and your heart and cardiovascular system are actually functioning fine. Most people with erectile problems face heart-related issues in 3 to 5 years, and there are very high chances. Now, what does it say? So if the pipe is slightly bigger, right, the water can still flow. In this case, the blood can still flow. Now, what happens if the pipe is thinner and thinner, the way it is organized around the penis, right? Now, the blood will find it very difficult to flow because it's already thin and there is some other blockage or damage inside them. The blood can't flow, and that's why you're not having an erection, which means it is just a matter of time before the same issue happens in arteries that are slightly bigger, which can potentially cause heart attacks or brain stroke if it stops flowing through the brain, right? Now, urologists and many doctors say very, very confidently that erection is the single best indicator of men's overall health. I'll read that again. Erection is the single best indicator of men's overall health. You can correlate it with, let's say, the periods in a woman. Maybe that indicates that she is functioning fine hormonally, mentally, etc. Similarly, for men, erection is the number one indicator that your overall health is actually okay and that you're fit to reproduce, because it involves cardio, as we saw, it involves vascular, it involves the neural system. Your neurons have to fire and send the right signals. Hormonal, because your testosterone, other hormones have to work fine, otherwise you cannot have an erection. And lastly, it is also psychogenic or psychological, which means if you are not in a great state mentally, you cannot have an erection. Think about the time you were unwell, or you were upset with your wife or your girlfriend or your daughter or your parents, whatever, right? Or you lost your job, you had a fight at office, something that affected you mentally. Do you think you'll be able to have an erection? It's not possible, because one activates your sympathetic nervous system, and for erection to happen, the other part of the nervous system, that is your parasympathetic nervous system, has to be active and behave really well. That's why this indicates that your overall stress levels and your body vascular functions, everything is coordinated and well timed. Now, penile vascular health, of course, we can do some exercise to increase the breast flow, but yeah, the other fact that I found that this is one of the recent videos that I saw to be able to do this video with you guys. I think it was Dr. Lyon and with some urologist. He basically says, this is a fact that I came to know very recently, that penis is a use it or lose it organ. It seems to be like a muscle, right? I mean, just like your muscle, if you don't use it, you will just lose it. If erections are not happening for over 3 to 4 months, you will lose your length, or the penis will shorten by about 1 to 2 centimeters of length, which means if you don't use it continuously in some form, if you're not getting erections, it will shorten. So you have to be very wary of it. Now, there is also other concerns that people might have. So I mentioned what erection indicates, that it indicates that you're fit for reproduction and that you can pass on your genes, and it's a great indication of your overall health. Now, there are also people worry about, okay, is my erection good enough? Is my erection sufficient? Right? That's a question that a lot of people might have. Now, what they say is 9 o'clock horizontal. Let's say you're standing like this, right? Of course, I don't want to stand and show, but let's say you're standing and this is your penis, right? So this is like a 9 o'clock position. This is me standing and this is your penis. That is, so if it's around 9 o'clock position, that is horizontal, it's considered normal and healthy. You don't have to worry too much. It basically says it's completely functional, often seen in men with longer, heavier anatomy or naturally flexible ligaments. Now you have to understand that this heavy plumbing mechanism and structural civil mechanism happening to hold your penis erect, right? It has to go against gravity, which means the whatever the muscles or the stuff that is keeping it together has to maintain sufficient erection so that the gravity doesn't pull your penis down when it's flaccid, right? So which means the internal have to work fine. Now, what does 7 to 8 o'clock indicate? That is if it is coming down, right? It is pointing that downward. It basically indicates a drop in arterial inflow pressure or weakened pelvic muscles. I'll read that again. It indicates a drop in arterial inflow pressure, that is the blood flow is not good enough or the pressure is pretty low, or weakened pelvic muscles. So that's on the downward part, which means you need work to do. Now, what's the best position to be in? 9 and above, right? So basically they say 10 to 12 o'clock. That is, this is 9, this is 10. And then 11 and then 12 is like almost hitting your navel or pretty close to your abdomen. It's kind of sticking through, right? A lot of men in their 20s can relate to that, it will be like this. Now, 10 to 12 is considered excellent vascular status, high arterial pressure, strong suspensory ligament. So the part that I mentioned about the suspension part against the gravity, it says it's a strong suspensory ligament, great pelvic muscles, and fully functioning blood vessel walls. Right. So this is what the erection indicates in terms of the position at which it is there, whether it's 7 to 8 and below or 9 and 10 to 12. So you guys can check it out when you get the next erection on the clock. Now, I'll just briefly touch upon some of the causes. I will not go deep into it because you already have this issue, which is probably why you are watching. Organic versus psychogenic, these are broadly the two classifications that you will find in ED causes. That is, 90% is actually organic or the natural causes, and 10% is psychogenic, which is like, say, related to mental issue or in a psychological parlance, right? Now, vascular issues are the most common cause, the 90%. Out of the organic ones, aging leads to degradation of smooth muscle cells in the penile tissue, causing blood leakage and poor erection. Second one is lifestyle factors: smoking, obesity, high blood pressure, diabetes, lack of physical activity, etc. Psychological causes can be stress, anxiety, depression, low self-esteem, and relationship issues can also play a significant role. Particularly, let's say you don't like your wife, or she has become unattractive, or you're not confident of yourself, you think your erection is pretty bad, whatever it is, right? These are psychological issues that can cause stress, or you think that your penis is too small and you may not be able to satisfy your wife, or performance issues. All of this is psychological, or it could be due to some side effects of medications and hormonal imbalance like low testosterone, etc. These can also be contributing factors, but today we'll stick to vascular issues. In under vascular issues, one of the things that I read, which I think you should remember, we mentioned as point number 4 of the origin of erection, how it works. Point 4, we mentioned the blood has to go in. The veins which drain the blood away, that is, take the blood back, has to be constricted enough. Like, imagine a straw, which is the vein which carries the blood back, but the straw is clipped. Like, you pinch it so hard that the blood can't flow back. That is your pinching part. And now, if this pinching is not happening, that is let's say the straw is not tightened enough, right? Or the erection is not hard enough to push it to a corner that it doesn't even have an opening. There'll be an opening, and which means the blood can flow back, in which case you'll get an erection and then lose it. You'll get an erection and then you will lose it. Now the heart is going to work really hard. Oh, what's happening? I'm sending blood, but he's not getting erection. He's losing it. He's going to pump harder and harder. And the harder it comes, the harder you lose the erection, which can happen to a lot of people. So this is called as venous leak. Yeah, it's a new term that I also learned. Key signs and indicators include fleeting erections. Erections occur but fade rapidly, even with constant manual stimulation. Position dependent rigidity. Erections may be easier to maintain when standing due to gravity assisted blood flow, but fade quickly when lying down. Soft glands. The tip of the penis, the glands part, remains soft and unengorged during erection. Now, I don't want to go too deep into how the glands works, the corporas and the different parts, because I'm not a biologist or a doctor, not a urologist, of course, but it would be sufficient to understand that there has to be enough blood flow into all the arteries and the capillaries that are there in your penis, whatever is there to carry the blood, so that the tip of your penis also is sufficiently engorged. That is what they call it as engorged, right? But if it is unengorged, it can lead to venous leak. Now, what are the other ones? Erections do not significantly improve. Yeah. They also say that if you have a venous leak, even medicines like Viagra or Cialis, these are some common medications people take. Men in 40s do that. And in spite of that, if you don't have an erection, it probably points to venous leak. The other conditions are loss of length or girth. Girth is the width, think of it as the width. Length, of course, is pretty straightforward. Noticeable narrowing or shortening of the penis over time. So we spoke about penis shortening. The urologist mentioned that if you don't use it sufficiently for over 3 months, it can shorten in length. Maybe it will also shorten in the width, or what we call as the girth in this case. A noticeable decrease in the quality of morning or nocturnal erections. Now, good that we had this point about morning or nocturnal erections. So for men, you have to understand that sleep is when you are during REM sleep, about 4 to 5 REM sleeps that you have is when you will have nocturnal erections, or what we call as morning wood. So typically at 4:35 in your fourth or fifth REM sleep, there is more testosterone production, and then your body kind of gives you a signal, okay, I'm going to get it up. That's called as morning wood, and then it just goes off. You don't even realize that you're having erections, because most of the times it's just happening subconsciously. It's a way of, the nature's way of testing that everything is working fine. Imagine you're in sleep and your body is saying, I'm going to check if every organ is fine. I'm going to repair things that are not fine, which is what happens in the sleep. It's also making sure your erection is working fine, your plumbing systems are normal. That is what morning wood indicates. And if you're not having that, something is wrong with you. Now, in the next few minutes, we're going to discuss about how to fix it naturally, right? Now, this is what we people are waiting for. In this, I will explain my own situation of roughly around 2020 to 2022. I was, what was I age? 42, 43 around that time, right? And I also thought that it's just because of age that I'm not having a proper erection. Of course, I had a lot of bad habits at the time. I was smoking excessively, drinking quite often, no exercise, and having crappy food, right? Or just eating whatever I could. So obviously, all of this led to erectile dysfunction, which at the time I didn't even know was an issue. And I assumed that, oh, above 40, maybe things don't work. That is what I had thought, and I never cared for it. Now, 2022, um, I think around April, May, maybe around June, I started going to the gym. I was doing three times a week. Nothing, just mediocre exercises, nothing excessive. Very beginner type, just go lift something and come back, spend time in the gym kind of a routine. Around August time frame, I completely quit watching any type of pornography. It was just incidental. I didn't know that it was connected to erectile dysfunction in some form, but I stopped watching pornography. That also happened in August 2022. And my sleep routine got really better. This was probably the biggest change. So 3 times a week of resistance training, about 45 minutes to 1 hour. Good sleep of 7 hours. I used to sleep by around 9:45 and wake up by around 5:30. So good 7 to 8 hours of good sleep. I also had slightly reduced stress at the time. And I mean, things just started looking up after that. In fact, by end of 2022, which means about, let's say, 3 to 4 months of effort of exercise, reasonable sleep, and lack of, let's say, any titillation artificially stimulated by women online, right? I avoid all of that. But now This was more than sufficient to get things working again, which is why I am telling this, even though it is quite embarrassing to be telling it on live camera, but that is a fact. So if you are going through the situation, all it requires is some small efforts to your routine to change it. But I will go scientifically and also explain what are the things that you need to do to make it work. We of course we mentioned that vascular is one of the main reasons it doesn't work, right? We discussed about brain, we discussed about nerve signaling, we discussed about venous leak, blood going in, everything is working fine, signaling is all fine, but the plumbing has a leak. What do you do? One is water not flowing in, that's a plumbing issue, which means the arteries are thickened or endothelial cells are not functioning fine. Your nitric oxide secretion is also not happening or production is not. There's too many various issues that we can go on and on about erectile dysfunction. For the large part, we will stick to vascular issues. Since vascularity is the main problem, the number one intervention that will help you is cardiovascular exercises. You can see if you have some other issues like a venous leak, your Cialis or Viagra are not really going to help you, is it? Right? So look at making lifestyle changes first to fix it, and then if it doesn't work, then obviously your doctor is going to say the same. But of course, go to the doctor and take the medication. So start with cardio, and if you like it, do strength training as well. Any of that is fine. A lot of benefits. Number two, sleep well. Right? I'm not even going into nutrition. Of course, that will help, but cardio and resistance training if possible, or at least one of it. Sleep well, 7 to 8 hours. And if you are a drinker, reduce alcohol consumption. And if you're a smoker, suggest that you cut it down or quit. Those are known problems for good erection, alcohol and particularly smoking, right? So you have to imagine anything that constricts the blood vessels, that your blood cannot flow. If your artery is wall is thickened, or there are blood clots under it, or there are fat deposits under it, or what they call as atherosclerosis. So if there's any problem around that, and if there is high blood pressure, etc., there are damages to the arterial walls, then your blood flow will not happen enough to sufficiently give you erection. And if you have a venous leak, you cannot hold your erection for long enough, so you cannot have penetrative sex or even masturbation, for example. Right now, these are things that you should do. Modifications like quitting smoking, maintain a healthy weight, which obviously will happen if you exercise regularly. Eat a good diet rich in fruits, vegetables, minerals, reduce alcohol consumption, eat well, you'll be fine. Now, of course, for people who have psychogenic issues, you'll have to go through cognitive behavioral therapy, where the doctor will kind of tell you what to do in terms of sequence, step by step, to improve your mind so that the triggering itself can happen. Go the natural way, guys. It really works. If particularly if you're in 40s, early 50s, I would still strongly urge you that don't try unnecessary medication unless, of course, your doctor says that you have to take it. But if you're someone who lost hope, you're worried if you can get it back naturally, yes, I'm telling you, you can, right? That happened to me. There's no reason it can't happen to you as well. So go for exercise, walks, runs, swimming, whatever it helps you. Do it for 3-4 months regularly, and don't keep checking it. It'll start working at some time. Sleep well. You can do a lot of it. If you don't sleep well, it still won't work fine, because you need your hormonal things to be sorted out. And sleep is when a lot of actual good work happens in your body. So don't mess with your sleep. If you're someone who's in your 20s and 30s, and if you're worried that you might actually, or your body will start indicating, if your erections are getting weaker and weaker, it's a great indication that something is wrong. And over a period of time, your heart or your arterial system is not functioning fine. Now, regular exercises, healthy diets, maintaining a good waistline. Of course, if you have too much of fat, uh, aromatase will convert a lot of your testosterone to estrogen, and with estrogen you're going to have weak erection, and the body's brain is going to think, okay, what is the point in producing more testosterone? Is just getting converted into estrogen. So it's kind of a vicious loop. Be very careful with adding more fat if you're a man. Now, we discussed pretty much every bit of it. The one thing I also want to tell you is, people who take medications without doctor's consultation. So this doctor was telling something about priapism, right? I don't know if people have heard of it. Priapism is basically a condition in which you take some medicines, like, let's say, what is it, Viagra or Cialis or whatever, and it becomes erect for way too long. So it's classified as erection that stays on for more than 4 hours. It can permanently damage the penis. So the plumbing system is permanently damaged if you have it for more than 4 hours. So be very, very careful. In fact, he says that they in fact inject and do something to drain the blood again. But if it's not done in within a few hours, I don't know, there's some time restriction, it's almost like a heart attack of the penis, and it is almost unfixable after that, right? So be very, very careful, guys. Don't take drugs without any prescription, right? That is what I'm going to say. Don't rely on friends' advice to just get an erection. Now, it's time for summary. So, erection is not just a physiological event, right? Of course, we start off in the mind. You saw somebody or your partner or a girl that you liked, you had an erection, and yeah, I mean the brain signal to your spinal cord, the nerves start activating it, indicated to make blood flow more into your penis. You got an erection, and then it has to hold now. But lack of it is actually a huge emotional turmoil for men, though they don't generally call it out. It can affect a man's confidence. It can make you feel emasculated, humiliated, and there is no self worth. Men may experience frustration, sadness, anger, and a significant drop in confidence. This is the part where my friend said, I would rather die poor with a good erection than die a rich man with no erection. Right? In many cases, it can even lead to depression, in which case it's again a rabbit hole or a vicious cycle where you don't have erection, you get depressed, and then the depression again doesn't help you, because whenever the body is stressed or depressed, it's going to cut off your reproductive ability. That is how the body functions, right? It gives more importance to keeping you alive than worrying if you get an erection so that you can reproduce. Now, a lot of times men also worry about disappointing the partners, or the fear the partners might leave them if you don't have sex, of course. So this is for all the women whose husbands may have some form of erectile dysfunction. If it's mild, moderate, it is fixable. What you need to do is give him confidence that it is okay. Don't engage into sex. Go to a doctor. Typically a good therapist will be able to fix it. The only thing you shouldn't be doing it is showing your frustration or making those faces that it's not getting it. I know it can be frustrating if you're a woman and you've not been able to have sex with your husband, but he needs your love and affection at this time to be able to fix it. Otherwise, it's never going to get back. So please seek professional medical advice. Whatever I'm saying is based out of my experience and the research that I've done. I would still strongly urge to please consult doctors and read more information online. Erectile dysfunction is the body's natural signal reflecting overall health, fitness, especially cardiovascular and hormonal health, which are essential for reproduction. From an evolutionary perspective, sexual function is closely tied to physical vitality, as successful reproduction requires good health and fitness. In the sense that ED is interpreted in some form as a kind of penalty or a feedback mechanism indicating that the body might not be in optimal condition to support reproduction or pass on your genes effectively. Poor lifestyle choices, such as lack of exercise, unhealthy diet, and excess weight, contribute to vascular and hormonal imbalances that impact erectile function. This can be viewed as the body's way of discouraging reproduction under suboptimal health conditions. So, this is basically nature saying you're not fit enough to reproduce. I know it is hard to hear if you are in that spot, but trust me, if you follow some of the basics that we discussed in terms of sleep, a bit of exercise, quitting some bad habits or curtailing them or reducing them, and having some nutritious food, you will be able to get back on track, and you will be able to have sex well into your 70s and even 80s. Now, that's the message I want to leave you with. So this is for my friends and all brothers around the world who still are grappling with this issue and are feeling quite embarrassed that I don't have anybody to talk to. Feel free to drop a comment. Happy to share more information if you want. Don't worry too much. Don't take stress over it. These things happen. Now, the key thing is to get it back working functionally. Happy erection time.